Ladies and gentlemen, you are about to undergo a coronary angiography. This examination has been prescribed by your cardiologist. So what does coronary angiography mean? What are the main principles of this examination and its different steps? Let's provide you with some explanations. The heart is a powerful muscle located in the thorax and able to eject approximately 5 liters of blood per minute. To work properly, it is fed by coronary arteries. Coronary arteries are small vessels which ride along the heart muscle. There are two, the right coronary artery and the left coronary artery. Sometimes these arteries are diseased and their caliber is reduced by fatty or fibrous deposits. In the absence of symptom, this can be detected by an exercise test. It can also induce chest pain and sometimes progress to a heart attack which wounds the heart muscle. The cardiologist can analyze your coronary arteries with thin catheters introduced by the wrist through the radial artery or by the groin through the femoral artery. He ensures their advancement into the aorta up to the origin of the coronary arteries, in which he administrates a contrast agent. Here is a real video of a healthy right coronary artery as it is visualized during the examination. And now a second video of the left coronary artery, healthy as well. If the coronary arteries are narrowed or occluded, a repair will often be performed called angioplasty, which consists in dilating the narrowing by a small balloon and in implanting a stent. The balloon is then withdrawn and blood flow is restored. Coronary angiography can be performed either as outpatient or during a brief hospitalization. At your arrival, you will be taken care of by the cardiology unit nurses. Do not forget to bring the list of your medications and results of latest blood tests, as they will be requested. Do not forget as well to mention if you have an allergic background. You will then take a shower with a disinfectant soap. Groin and wrists will be shaved carefully, and the nurse will put you on a drip. Coronary angiography is practiced in an operating room called cath lab, either under local anesthesia or light general anesthesia. You will be installed into the cath lab by the medical staff. After a second disinfection, you will be covered with sterile sheets. An X-ray tube will turn around your chest and allow the visualization of your coronary arteries. During the examination, the cardiologist will monitor your vital parameters on a large screen to ensure your safety. He will perform local anesthesia and puncture the artery through the skin. Therefore, there will be no scar. A small catheter will be placed in the artery, and coronarographie probes will be led up to the heart. If coronary arteries are normal, the examination will be over. If they are diseased, an angioplasty will be often considered and sometimes performed during the same examination. In more serious cases, surgical bypass can be proposed afterwards. Here is the example of a right coronary artery narrowed by more than 90%. The cardiologist implants a stent on the sick zone. You can see the complete disappearance of the narrowing. This second case was realized in emergency during a heart attack. Left coronary artery is totally occluded, and the cardiologist will restore blood flow by implanting a stent. If the procedure was done from the groin, a stasis will be done and you will be confined to bed for a few hours. If it was done from the wrist, a device will be placed to avoid any bleeding and you will be able to get up quickly. You will then be led back to your room by the medical staff, who will look after your comfort and safety. After leaving the hospital, you will check on the puncture zone for a few days. If an hematoma appears, do not hesitate to contact your doctor. You will thoroughly take prescribed medication, especially clot-preventing agents, which are mandatory if a stent was placed. Hoping this video has provided you with all key information about the main principles and steps of a coronary angiography, and that you will be much more confident in undergoing this examination.